Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. Hey, today I'm excited to present Dr. Susan Chobanian, a really exciting, delightful lady who grew up in Wisconsin, and she works as a facial plastic surgeon in Los Angeles. And again, I'm a primary care doctor. Those of you who have listened to my podcast for a while know I work in rural Idaho. Most of the people I refer to are cardiologists or nephrologists or other various subspecialties. And once in a while, I refer to plastic surgery, but not that often. It was really interesting to meet Dr. Chobanian and hear her perspective and her kind of hometown and lovely approach to patients that she really cares for deeply. And she's also very technically proficient and has gained a great reputation for having excellent outcomes. And I rarely find doctors who love what they do so much that they want to keep doing it for a long, long time. She's one of those unique, rare doctors, and she's found this gift of being able to help people. I found her interview very personally motivating. I think you'll enjoy it too. Thank you very much for tuning in. I'm excited to welcome Dr. Susan Chobanian here with us today to the Doctors Making a Difference podcast. Dr. Chobanian, would you mind introducing yourself to our audience?
Hello, I'm Dr. Susan Chobanian, and I've been practicing in the Los Angeles area. Specifically, I'm in Glendale, California, and I've been doing plastic surgery and cosmetic surgery for over 25 years. And it's something that makes me very happy. It makes me very content. And I'm proud to say that I have operated on second and third generation patients in my practice.
Oh my goodness, that's awesome.
I appreciate you inviting me here, Dr. Crane. It's a pleasure to meet you. And ask me any questions you'd like.
Yeah, well, I appreciate it. When most of the audience for the podcast are physicians, and I think people go into medical school with this, we're all kind of starry-eyed when we start. We want to make this big difference and this big splash and help lots of people. And then I think people get a little ways into medicine and residency and all this stuff, and they say, well, this is very hard. It's a challenging job. And surgery is a long path to become a surgeon. So I want to unpack just a little bit of briefly your history. Why did you choose medicine? And then why did you choose to become a plastic surgeon specifically?
Well, when I was in undergraduate school, I really didn't start out to go into medicine or to become a doctor. I went to college to become a math and science teacher. And I started very early. I graduated from high school when I was 15. I started college when I was 15.
Wow.
And I did my major in math and chemistry. I had double major. And I started practice teaching. And it was very difficult for me to practice teach because most of the students were my age at that time.
Fair enough.
And I thought to myself, I think I would like to go into medicine. My father was a dentist, and our social contacts were doctors and dentists and people who were in the medical profession. And they were the original dedicated, hardworking, day and night doctors. And I always admired what they did. And I admired the difference that they did for people. And people respected them and looked up to them for what they did and who they are, who they were, not for what they had. Okay. And that always inspired me. And so I thought to myself, you know what? I'm going to make an application to medical school. And if I get in, I'm going to go. And lo and behold, I got multiple acceptances to different medical schools.
Well, you were like the Doogie Howser of your time, age 15, graduating, starting. I mean, I bet you were a hot ticket. I bet a lot of people wanted to have you.
You know what? I grew up in Wisconsin. I'm Wisconsin raised, and I never thought of myself as a hot ticket. Okay. It was a very sedate, very middle-class society that I grew up in, and I enjoyed it. We had a wonderful lifestyle. We were very content. And we always looked up to the medical profession for how they help people. And like I said, I started medical school when I was 19. I graduated when I was 23. At 23, I was the youngest licensed physician in the state of Wisconsin.
Goodness.
And I never felt that I was at a disadvantage being younger. I mean, academically, When I got to medical school, there were a lot of my classmates who had more savoir-faire. Some of them had PhDs, some of them had master's degrees, some of them had been married, some of them had children, some had been in the military. One of my classmates was a graduate from West Point, and he was a very savvy guy. I mean, so I had to compete with that. But I enjoyed medical school, and I enjoyed becoming a doctor, and I enjoy being a doctor. I enjoy taking care of patients. All right. As a plastic surgeon, I just don't produce a product. I need to take care of the patient. And I've never forgotten that. No matter what specialty you're in, you need to be a good doctor first. At first, I was the youngest doctor. And now my goal is to be the oldest doctor.
Oh my goodness, you must love it. We talk about on the podcast folks who, all of us, again, start off with these bright aspirations, and it's hard. You went through a surgical training. It's lots of years and lots of training and lots of challenges. And so, but you're in it to win it. Like you said, you started off as one of the youngest, and you're not just looking for an exit path. You want to be one of the oldest that is practicing. That's quite unique, actually.
Well, as a physician, I think it's how you set your goals. I mean, as a young doctor, you always want to be the busiest. And then all of a sudden you want to be the wealthiest. And now you just want to be the oldest. And I never thought about the first two, really. When I first started practice, I have a nurse. My nurse has worked for me for 38 years. Okay.
Wow.
And she remembers when I was first in practice, my goal was to operate on the second generation. And I've reached that goal. In fact, I've surpassed it. Some of them I've even operated on the third generation.
That's
and
amazing.
Like I said, I started at a very young age. Okay. I was in my 20s when I started private practice, and I'm still here. And I enjoy every day. I enjoy every minute. I wake up in the morning eager to go to work.
That's pretty cool. So talk me through this for just a second. Most physicians are not plastic surgeons. There's plenty of plastic surgeons in the world, but when you kind of look at the balance, most doctors are not plastic surgeons. What's the day in the life of a plastic surgeon like, and what do you like so much about your job?
Like I said, I didn't start out in plastic surgery. I trained at the Medical College of Wisconsin and the Medical College affiliated hospitals. I started in ear, nose, and throat. I was an ENT doctor. And Wisconsin, being cold weather, and I did a lot of head and neck cancers and head and neck trauma when I was in Wisconsin. And the weather was cold, and some of the cases were very challenging. Some of them were downright depressing. And I always thought to myself, if I get a chance to study something that's a little bit fun in a warm climate, I'm going to go. And a fellowship in facial plastic and reconstructive surgery opened up in California. And I was fortunate to get accepted, and I did it. And plastic surgery is really a merger of the art and science of medicine. Okay. It really blends well. And it's not just artistic in terms of what we create, but it's also artistic in the way you handle and care for your patients, because we're making a difference in the patient's psyche, in the patient's self-confidence. Okay. Everyone has a right to feel as though they're within the realm of attractive people in the universe. And you give them or you change them physically to make them appear or make them feel as though they're more attractive. They increase their confidence. They increase their ability to succeed in life. I think that's one of the myths of plastic surgery about vanity. They think it's conceited, when in reality, you're dealing with the patient's desire to be successful. And like I said, I've operated on first and second generation patients. And yes, I follow my patients and they contact me. Successes are, I think that's the success of my practice, making people succeed.
Well, so that's really an interesting thing. So, Dr. Chobanian, one of the questions that I have been asked periodically, or I've had myself regarding plastic surgery, pertains to scope of practice, type of patients, and some misconceptions. I think a lot of people say like, oh, it's plastic surgery. It's just for the well-heeled or the people who only have vanity. But I think it's such a more complicated, challenging field. And you come at it from the standpoint of working for years as a ear, nose, throat surgeon, having done plastics for a lot of years. What have you found are some of the biggest misconceptions about plastic surgery? And what do you actually do? How have you found that your work influences your patients?
Well, I think the biggest misconception about plastic surgery is that somehow patients seek it out for the sake of vanity or conceit. They're self absorbed or selfish people, but that's not true. Okay. Patients who seek out plastic surgery, it's not just about vanity, it's about their desire to succeed. Everyone has the right to feel as though they're part of the realm of attractive people, and they deserve the greatest amount of self-confidence they can have to succeed. The other myth about plastic surgery is that somehow it's limited to just the very wealthy people or people who are celebrities, and that's not true either. Okay, plastic surgery, especially in Los Angeles, has become very commonplace and actually has become very affordable for our patients. The other myth about plastic surgery is that somehow it's only for women. Okay,
Mm,
and that's not true either. Okay, on certain procedures, like for rhinoplasty procedure, I do about 50% women, 50% men. And in fact, when I was first in practice, I shared an office with two other men, and I used to get more male patients than they did combined. Okay.
interesting.
And the other interesting fact is the other day I had a male patient and he says, I love going to female doctors because they pay more attention to detail. They are more accurate. That's what he told me. And
Mm,
he said they get a better care of the patient. Okay. So I was very flattered. And of course, I did his surgery and it turned out very well.
good.
So, those are some of the myths about plastic surgery. It is a challenging field, and you still have to treat the patient as a whole. Okay. I think I always talk to the patient. I try to do a very in depth consultation. I want to know what their goals or where they are in their life, what they do, and I help them succeed. And like I said, I've been in practice for many years. I've done generations of patients, and I follow my patients follow me. And daily and weekly, I get messages through the internet, through the social media about how their life has changed after I did their surgery. And that makes me feel really good. It makes me continue to work,
Hmm.
and it's the success of my practice.
Well, as you said, you started off as one of the youngest and you like it so much you want to continue to practice till you're one of the oldest, which is pretty cool. And it speaks volumes to say that people have come back generation after generation. You have third generation patients who have come back and said, we want your services. And then, like you said, one of the things that you found most meaningful is to restore confidence and to have somebody feel I'm a normal part of society. And whether that is their perception or whether that's their reality, it's really important for people to have that level of confidence. And I can see why that would be quite gratifying.
It has been. That's why I continue to practice, really.
Yeah.
Okay.
Another question is a lot of the listeners to the podcast are early stage. They might be pre-med students, medical students, residents, people who are considering, a long career in medicine. And so talk through for a second, what would you tell someone who's considering this? And maybe some of their colleagues are dissuading them from plastic surgery and someone says, I really think this might be my calling or the thing that I could do. What kind of advice would you give them?
I routinely have medical students and even interns and residents come and shadow me in my office. Okay. I frequently have people who come. So I try to set a good example. Okay. I think plastic surgery is really a fine combination of the art and science. I think it's also a very technical specialty. Okay. You're a surgeon. Okay. You have to be good with your hands. You have to like to work with your hands, and you have to be technically adept. The other thing about surgery is to sustain the practice, you're somewhat of an athlete. You have to have sharp eyes and a strong back in
Mm-hmm.
order to last. Okay. And I can do it. I was never an athletic individual. However, in order to maintain my physical prowess in the operating room, I work out 3 days a week. I'm at the gym at least 4 days a week. And I set physical goals for myself in the gym. I can deadlift 120 now. Okay.
Wow, that's
On
awesome.
Saturday mornings, yeah, I run 2.8 to 2.9 miles in 35 minutes. All right. So I keep myself physically in shape because in order to do a good job in the operating room, you need to be physically adept. The other thing is you need to be somewhat of a psychologist. You have to talk to the patients. You have to understand what their motivations are. Okay. The patients, I always give them the mirror. I say, take a look in the mirror and tell me what you don't like about it. I want to know what their perception is, whether it's realistic, whether it's unrealistic, and what their goals are, what they hope to achieve by having plastic surgery. If they think that plastic surgery is going to change their entire social situation and give them a life that they can love, you have to be weary of that patient.
Hmm.
But the patient who wants to look better because they want to present themselves better at the workplace or socially or wherever, or make themselves feel more confident when they look in the mirror, that's very important to understand. So I always do like an in-depth consultation. I have my medical students or my interns or residents, they sometimes come to shadow me in the office, and I always let them sit in on the consultations so that they know how to select the patient and set the patient's expectations.
No, that's perfect. Like you say, that when it went into medicine, it wasn't necessarily just to do surgery, it was to help people. And that's what you're describing. Like you said, there's a psychological aspect of it, and you need to set proper expectations. And there's a really powerful technical aspect. And then you hit on something that we don't talk about very much, which is physical fitness that's required to be able to function as a physician. You can't do this really intense job, particularly if you're doing a lot of hands-on, hours long surgeries. You can't do it unless you're physically fit. So I think that's a really valid point. I appreciate you making that. One of the other questions on that is, you have become known as the queen of the rhinoplasty, is what I have understood. And so I'm interested, you are forging ahead, trying to make this field better than you found it and try to leave a lasting impact for patients and then also the residents and people you teach. How have you developed that technical proficiency, and what have you observed over your career as far as changes in the way you approach rhinoplasty or other surgeries?
The whole concept of rhinoplasty and what the patients expected years ago is much different than it is today. I mean, years ago, we had the Estee Lauder model, and everybody wanted to look like her. It was much more regimented. Okay. Years ago, the concept of American society was a melting pot. I don't think it's any longer that. I think now America has become a salad. Everybody has their individuality. Everybody has their diversity. Everybody has their ethnicity or their racial characteristics that they want to preserve. But we want to tweak it a little bit, atone it a little bit to make them look more attractive or make them more confident so that they can succeed in society, in the world, at the workplace, on the corporate ladder. So I think plastic surgery has evolved, and now we have to satisfy the diversity of our nation and the diverse people we have in our nation and preserve their ethnicity. Years ago, everybody wanted to look like the same model type. Not anymore. Everybody wants to preserve their identity, but we want to tweak it to make them a little bit more attractive and give them more confidence.
That's an interesting take on it. Like you say, instead of having everybody look similar, we want to really preserve it. And so when you do rhinoplasty, do you look at the person's family history or their ethnic heritage? How do you plan that? Because a lot of times people come in with a certain thing in mind. And I imagine that's kind of hard in some ways to be able to say, how do I want this to look? The person's trying to verbalize it, but how do you actually plan that so that a person can have the aesthetic outcome that they're looking for?
Yeah, I do my consultations probably differently than other surgeons do. Okay, I ask the patient, first of all, what they don't like about it. And then I ask them what they want to look like with the nose. I ask them, what kind of nose do you want? And the patient will sit there. It's very difficult for the patient to explain in words exactly what they want. So then I'll tell them, show me some pictures. Everybody says, I want a natural look. Everybody says I want to look natural, but what's natural for one person is not natural for another. I always take the pictures of their face and nose. I get the pictures printed immediately. I show them their pictures. I look at pictures of noses that they really love. Okay. And then I will actually draw for them on their photograph what kind of nose they want. And they look at the picture. They look at that nose that I've drawn on their picture, and they'll tell me whether they like it or not, or how they want me to change it. Okay. And over the years, I've honed my surgical skills and my surgical technique that I can come very close to what I draw. I've worked very hard on it. Over the years, you have to be very self-critical about the work you're producing. The patient may be very happy with the result that you've given them, but you have to look at that result critically. And over the years, I've honed the technique. When you talk about technique, I do practically 95% of my noses closed rhinoplasty. I'm working through the nostrils on the inside without any scars on the outside of the nose. And oftentimes I fix it functionally and I fix it cosmetically. And I do it as in a closed technique. And that's why my patient population, actually, they came up with the monitor. They said they call me the queen of rhinoplasty.
Right.
Okay? Because I try to create as natural a look as possible. It depends on what the patient wants. The other thing is, sometimes I have to put my own likes and dislikes aside because I have to deliver what the patient wants to see in the mirror. Okay. And in Los Angeles, I practice in Los Angeles. I'll be honest with you, 99% of the patients are very accurate. The patients who seek out plastic surgery know what looks good on them. We've researched it. And actually, it's been studied. The average patient will think about plastic surgery for 2 years before they actually come to the doctor for a consultation to have it done. So they've thought about this for a pretty long period of time. And most patients are actually very accurate. They're very realistic as to what looks good on them. So I listen to the patient. And like I said, with plastic surgery, it's imperative that you deliver what the patient wants to see. It's important. Otherwise, you're going to get burnout.
Oh, yeah. No, think about the difficulty of doing that type of surgery through the nostrils without cutting the skin. And then, especially with your background as an ENT, you can fix some of the functional issues with the nose at the same time. And I can see why it would be such an important and powerful thing that you can offer to those patients.
Closed rhinoplasty, honestly, has become a lost art. Okay. Open rhinoplasty is much easier. You skin the nose and you're looking right down on the anatomy. Working through 2 nostrils with specific lighting, I think it's more difficult, but I think it gives the patient a far better result. I think they heal faster. I think they get less bruising, less swelling. And of course, most of the patients that come in for rhinoplasty are somewhat teenagers. They're young people. And I think to put a scar on the outside of the face is not appropriate because they have to live with that for the rest of their life then.
Right. As you're passing this information on to residents and fellows and others that come with you, would you say that the closed technique has reinvigorated, or do you have people that are adopting that, or do you feel like it's diminishing?
I think there's a trend to go back to closed rhinoplasty simply because the patients are more attracted to it. Okay, if the patients can have a closed rhinoplasty and you're going to do it without any scar, they're more inclined to be favorable toward that procedure. And so I think there's a trend back to closed rhinoplasty. It's a scarless rhinoplasty.
Oh, that's amazing. Well, I was curious as we go through this, we don't want to share anything that's HIPAA protected or anything like that, but you have these multi-generational families that you have helped. Are there any stories you could share of people that said, like, I went and got a surgery and it changed my life, it changed my career trajectory, it changed all? Are there things like that you could tell, like, again, in a HIPAA protected manner?
Yeah, I get cards and letters every day from patients. And like I said, since I've operated on generations, patients will come back to me. I've done thousands of patients. Okay. If I go to the grocery store, if I go shopping, I'll inevitably bump into someone and they'll say, you did my daughter's nose 15 years ago. And now she became a doctor. She became a lawyer. She became a dentist, or she got married and now she's got 5 children
Mm.
and she's very happy and you did a beautiful job and the nose still looks good. So I get stories like that all the time. I get letters. Even if you read my social media, people will say, I'm so glad you're still in practice. I saw your post. I saw your videos. I love you. I follow you. You changed my life. I had no self-confidence. And then, my life expanded and they'll tell me the details. There was one case I remember though, and it struck me when I was first in practice. I did a facelift on an older woman who was very successful. She was a professional woman. She was a businesswoman. She was very successful, very well accomplished woman. And I did a facelift on her. She came to me for a facelift. As I was taking out the stitches, okay, she started to cry. And I said, Mary, I said, why are you crying? I said, the surgery went well. You look great. Everything turned out great. And she says, doctor, I'm going to ask you a question. And I want an honest answer. She said, am I ugly? And I said, Mary, why do you ask me that question? I don't think you're ugly. I think you're a beautiful person. All right. And she said, well, I was driving down Sunset Boulevard the other day and some kids pulled up me in the car next to me and they screamed. They said, look at that ugly lady in the Rolls Royce. And she said, do you think I'm ugly? I said, not at all, Mary. I said, beauty is the entire person. And I didn't think she was an ugly person. Of course, she was not, model beautiful. Okay. She wasn't Lady Godiva, but she was an attractive woman. And I said, Mary, your beauty is the entire person. Okay. I said, we did the facelift. We tightened up the neck. We tightened up the jowls. We lifted your cheeks. You look great. I said, it's really the entire person. And I think that sort of went through me like a knife, that the reason why people sometimes seek out plastic surgery is because they want to feel as though they're part of the realm of attractive people, and it builds their confidence. And I think my personal belief, I'm a person of faith. I think all of God's creations are beautiful. Mm-hmm. Okay? In general, all of God's creations are beautiful, but beauty is really the entire person. And if you help that person succeed and they're content and what they do, then as a plastic surgeon, as a physician, as a human being, I've been successful. And I think that's the key to having a good life and a successful profession.
No, those are wise words. I like what you're saying. Like when I talk to people of different specialties, sometimes people just want to talk about the technical aspects of what they do, which is interesting. But I can tell you have a whole person approach. You really want to make sure the person gets to the outcome they want surgically, but there's kind of this psychological, social part of it that's very important. And so I think it's really fascinating what you do. I can hear the passion in your voice. I can tell you enjoy doing what you do and why you still want to keep doing it. What advice do you have for physicians at large? You see doctors of different stripes all over the place and patients that have interacted with physicians, particularly as it pertains to perception of patients, how they're received and how they perceive themselves as they interact with the medical profession. Do you have any advice or insights for other doctors who are listening who may want to take something away from this?
Everybody wants to treat the patient for what their specialty is, all right? But I think that we need to address the entire patient. It's sometimes very difficult and it's sometimes very time consuming to do that. But to deal with the issue as a plastic surgeon, it's very easy for me to say, yeah, okay, I produced the result and I don't want to see, but I follow all my patients for 1 year. My rhinoplasties, I follow for 1 year. My revision rhinoplasties, patients who've had surgery elsewhere, they come to me for a revision. I follow those for up to 2 years. My facelifts, I follow for a year. Okay, I want to see the healing process and I want to see my patient's success. Okay, within that year period, I can see teenagers blossom. I have one patient, he invited me because they're having a party for his promotion at the company he works. I operated on him about 1.5 years ago. Now he's got a promotion and he's a much more confident young man. I get invited to weddings. Okay, if their goal was to find an appropriate mate, they've done that. And I think that's what medicine is really all about. Okay. Even in the darkest parts of medicine, I have friends that are medical oncologists. I have associates who are cancer surgeons, and it's very serious and it's very difficult work. Okay. The limitations there and the results are sometimes just God given. All right. And medicine, as hard as we try, we have our limitations. All right. With plastic surgery, we can set the limitations ahead of the surgery. We can set the expectations ahead of the surgery. And then when I feel that I can hit a home run, I give the patient as much hope and as much optimism. And when I deliver, then I can see the success.
No, that's great.
It was a kind of difficult question, but I hope I answered it.
No, you did. It's really important. Again, you've talked repeatedly about this whole patient approach and that we try to help people to become a better version of themselves. And no matter what specialty of medicine you're in or what age group you're dealing with, that's really is to say, how do you live the best life you can? And how can I help you be just a little bit better within the context of my training? And none of us can do it by ourselves. It takes a group of us as physicians. One of the things I wanted to give you a chance to do as we wrap up our time is, where can people follow your work? Do you have a website or a social media profile or LinkedIn or someplace people who are interested to say, I want to follow and see what she's doing?
Yeah, I have a website, Susan L. Chobanian, MD. I'm on social media. I'm on Instagram. I'm on Facebook. I do videos. I do posts. And yeah, my website, susanlchobanianmd.com.
That's wonderful. Thank you so much for taking the time to share your insights, your experience, your knowledge, your wisdom. And again, I'm pretty excited to hear not only what you're doing, but I think it's pretty cool that you love it enough that you want to keep doing it. You're not looking for an off-ramp. You're still wanting to continue to do this. And who knows, maybe you'll be to the 4th generation someday.
From your mouth to God's ears. Thank you.
You're welcome.
Dr. Crane, it's been a pleasure.
Likewise. Thank you very much.
Yeah.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.